Hey kiddo, my friend Brett there told me you weren't feeling very good and have to spend some time in the hospital. That's too bad. I bet you're really mad about having to miss school, huh? Ha ha ha. No really, he told me you weren't sure what was going on and needed some help understanding nephrotic syndrome. Well, I invited another friend over, Boxbutt, to tell you a bit about what's going on with your kidneys. Boxbutt, the stage is all yours.
Hey there, sorry to hear you aren't feeling so hot. Let me help explain what's been going on. Normally your kidneys are one of your body's organs that act like a big filter for your blood. In fact, the heart sends your kidneys about 20% of what it pumps out. That's a ton of blood for two kidneys that are about as big as your fist. Take a look at where your kidneys are in your body.
Tell him what the kidneys filter.
Your kidneys filter all of your blood, and when they are working normally, only water and some small molecules get filtered out and become your pee. The more concentrated, the darker your pee is. Take a look at this short video that explains how the kidneys work. Brett, take it away please.
Wow, that video was so cool. I totally get what the kidneys do. So what's wrong with his kidneys?
Your kidneys got damaged somehow and protein, especially albumin, is leaking out of your blood and into your pee. Because the kidneys can't stop the protein from squeezing out, water also starts seeping out your blood vessels in other parts of your body. The kidneys try and hold on to as much of the water and sodium as they can, but they just can't keep up. So now your blood becomes thicker and you start to swell up. That swelling is called edema. Lipids, or fats, also start building up in your blood.
How do they figure out if he has nephrotic syndrome?
The doctors and nurses will look your history, your current symptoms and your age to help diagnose you. They will also check your pee to see how much protein is in there. Remember, kidneys that are working normally shouldn't have any protein.
So how does he get better?
The goal of everyone at the hospital is reduce the protein in your pee, reduce all that water or fluid that has seeped out from your blood vessels, prevent infections and minimize any problems you might have from the treatments. The first thing the doctors will probably do is put you on a drug called a steroid. The steroids will reduce the inflammation and swelling in your body and most importantly, shrink up those holes in your glomerulus of the kidney where the protein is squeezing out. Since you might also not be too hungry, everyone will work to change up your diet and figure out something that you would like to eat that is good for you.
Ah, that doesn't sound too bad. I had another friend that was taking steroids to get better and he was really moody, ate a lot more than he usually does and started to gain weight. Will that happen to my new friend here?
Unfortunately yes, those are some of the side effects. Your doctors and your parents will keep a close watch on you though and make any changes to how much you take. Once you leave the hospital, you may also have to start eating food that has less sodium or salt. It's also going to be important for you to avoid getting sick. So if there's someone at school who has a cold or doesn't feel good, don't get too close and always wash your hands.
What happens once he's better?
Once you get better, which should start happening in a few days after you start taking those steroids, you and your parents need to keep a close watch to see if this starts to happen again. Unfortunately, nephrotic syndrome is something that comes and goes and relapses are common. Your parents will test your pee periodically to see if there's any protein in it. If there is protein, they can contact the doctor and get you on some medicine.
Will he have to go back to the hospital?
Luckily no. The best way to get better is to stay at home and attend school. You just want to avoid any friends that are sick.
Can he still play sports or be involved with other activities?
You most definitely want to stay involved with all your after-school activities and sports as long as you feel well. Just remember to stay away from anyone who is sick and be sure follow instructions from your parents, nurses and doctors. Well, I hope you feel better and see you.
Thanks Boxbutt and thanks Brett for inviting us over. Hope you feel better kiddo and don't forget to listen to your great nurse there. See ya around.